Back with Dr. Stevens from Manhattan, from the Small Apple, Manhattan in Kansas. All right, Dr. Stevens, I want to talk to you about something which is really, I think it's important. When it comes to gum disease, periodontal disease, gingivitis, all the same thing, just slightly, gum disease is periodontal disease, it's just the English word for the Latin word, I guess, or whatever the heck. And gingivitis is a little bit less. It's when the whole thing starts. I assume so. Am I more or less right here? More or less.
You are, yes.
Okay.
Gingivitis is a beginning.
All right. So every dentist, when he talks about gum disease, he's talking about that you will lose your teeth eventually. And while this is true, and while this is very, very bad, I think it doesn't even hit the, that, what do you call that, that iceberg, that tip of the iceberg which shows out, simply because of this. Okay, number one, you dentists have become superbly good over the last decade or two to put in false teeth. Implants, crowns, bridges. I mean, yes, they're the second best thing, but they're damn good. They've become good at it. It's not anymore like George Washington, who apparently had a wooden tooth. I'm not so sure, but that's the story. Okay? That must have been awful. So you're good at it. And it costs a truckload of money to put a truckload of implants in it. So there are handicaps, and for some people, like, all right, money, fine. Who cares? And of course your mouth must be stinking while that is happening, so that couldn't be good. But I still remain, here is what the bigger problem is. You have an infection in your mouth. It's like that yellow, reddish, ugly pus when you cut yourself and it gets all ugly. And it's in your mouth. And when you chew a steak or a potato, it mixes it up, it goes into your stomach, and it goes all over the body. And whatever doesn't get mixed up with your steak and your potato trips right into the blood vessel, because we know that the gums, the mouth inside, is the gateway to the blood vessels. If a guy is unconscious, you put some drops in under his tongue, and he goes, ooh, I'm back. So that means it goes fast. Everything you want to get fast into the blood, you put under your tongue, right?
Yes.
Right, so you have that infection, that yellow, ugly pus there, dripping into your blood and getting mixed up, going into your stomach, and it ruins the liver, because an infection is an infection. It infects other areas. That's the definition of it. The liver, the kidney, the stomach, the blood, diabetes. I have heard that there is it's apparently a major fact that pregnant women have premature births and thus underweight babies. In California, there was a lady who had a stillborn baby because they found that yellow, ugly pus in her placenta. Immune system goes down. It looks to me that no matter how bad losing all your teeth is, even if you have then to get the cheapest denture of all cheap dentures, because you can't afford it and it's really not so much money, no matter what it is, all that stuff couldn't possibly be as bad as ruining your liver, your kidney, your blood, your diabetes, your immune system, and maybe having a problem with baby births. I mean, that seems to me irreparable. How far off am I with this concern?
Well, there's no doubt that the infection anywhere in your body is a concern. Periodontitis, periodontal disease, gingivitis, all of those things. Itis means inflammation. Inflammation is a result of an irritation, and in the mouth, that's from bacteria. We have to control the bacteria, or it is absorbed both through our digestive tract, through swallowing toward our stomach, and in our circulatory system. It's absorbed through the blood vessels or pushed into the blood vessels from normal chewing. And with gum disease of any stage, when those vessels are swollen because of inflammation, then they are more susceptible for absorbing the bacteria.